Exactly.
I know,
Exactly.
it is. We got to learn to roll with it.
Yeah.
Let
I
me
mean,
make sure.
if we haven't learned anything this past year, it's to roll with it, right?
Absolutely.
Definitely.
And people
Let me.
became more tolerant, I think.
Yeah,
Well, hopefully.
right. Well, sometimes it's trying people's patience too. How you doing, Max? I see you like.
I'm good. I'm
like
good. I want to make sure this is working in our event.
Well, we're live in the Life Over 50, a life redesigned, right?
We are, and we're live in our group as well, which is pretty great.
Oops, I got to go on mute.
Yeah, you're having some trouble over there, but I'm trying to make sure we're going live in this group. So if anyone is watching it from there, just reach out to a girl. Let me know. And Dawn, where are you coming in from today?
Coming in from Los Angeles, California.
Oh, that is awesome. That is a beautiful, beautiful place. How long have you lived in LA?
My 10-year anniversary, wedding anniversary is coming up. So 10 years.
Wow, that's a long time.
Maggie, I see you live in the group.
Do you see me live on this event? Oh, I think people see, if people see that they're live in the event, I would love them just to let me know, because that would be super helpful.
And how would they let you know?
They just put it in the comments and I can see those, and that would be great.
In the comments in the group, right? We see you, Maggie?
Yep, just we see you would be great. So, yep, I see that we're in 1, 2. All right, you guys just keep chit-chatting it up and I'll be with you in a minute.
Maggie's got remote control issues over here. She's trying to land the plane. I feel like she's always looking at some kind of dashboard over there because I see her eyes jutting from one screen to the other, to up and down, and a lot of clicking is going on. So she is our she's our remote control guru behind the scenes and in front of the scenes.
It looks like it's all going good. So we're just gonna keep rolling with it.
Okay, good. Way to go. And I was telling everyone my saga about the drilling, which can you hear now? I might have to go on mute.
Yeah, the drilling. So, but yeah, you go on mute. I'll take care of this. Don't worry about it. And so, yes, Purse Strings is always here to help you with all your financial questions. We offer a ton of free financial education geared towards women because they have been underserved and we don't always have the financial education. So we got it here for you. And if you don't have any, if you don't find your question answered, we have a ton of professionals who would love to help you answer it. So just submit your questions at any point. And then we have wonderful Purse Strings approved professionals like our good friend Dawn over here, who will really serve you the way you want to be served, look you in the eye, respond to your calls. It's pretty amazing stuff. But we love Dawn. She's a great time. And you lead the Medicare community, right? You don't lead the whole Medicare community. I know that. But you lead you lead your own organization, right?
I am a leader in my industry professional association. It's the Association of Health Underwriters. So I am a leader amongst many leaders in there. And I also do have my own, I've started a group called Medicare Builders in Los Angeles because the profession in the Medicare world, are changes in every situation's unique to each individual. So it's really helpful to have a group of professionals that come across all of these situations to educate each other.
That's awesome. Yeah, and it's great. I mean, we're all about constant learning, constant education. Right. So things are always changing, and that's just the way it is.
Yep.
So, Dawn, let me give a little intro to you, and then I'll give you the floor.
All right.
So Dawn continues to find that her passion lies in helping each person understand their options in regards to what health insurance they pay for and be able to make the best choice for their families. She approaches it as a math problem and then finds the solution. At M&M Benefit Solutions, they provide healthcare solutions for Medicare eligible beneficiaries, individuals, and families. One of their passions is helping people understand their Medicare options with the future that they want to live in mind. She helps you navigate through the countless options to determine what health insurance is best for you while considering important lifestyle and financial concerns. So with that, Dawn, I'll give you the floor.
Well, thank you so much, and thank you for having me here today. I am honored to speak to this group. One of the things that I want to start with is making sure I'm talking to a group of women, and women typically are the ones who take care of themselves last. So I wanted to mention how important it is to do if you have health insurance, your preventive care is at no cost to you. It's important to go get those wellness checks, because those are what help you live longer and better into the future. When things are caught early, it's much easier to treat them and much easier to get rid of them. So I wanted to plug that before I jump into some of the details of protecting yourself financially when it comes to healthcare. A couple of things that have happened recently. You may have heard about the American Rescue Plan Act, which was signed by President Joe Biden on March 11th. And that in that act, there was a subsidy given for 100% COBRA subsidy given to people who are on COBRA. It also increased the subsidies available for higher income earners. So if you don't have health insurance through your employer and you have to purchase it on your own, if your income, there's what they call a federal poverty level chart. And if your income landed above 400% of the federal poverty level, then likely you wouldn't be eligible for a subsidy. And just so you know, a subsidy is a tax credit, which means that all of it relates to when you file taxes at the end of the year. You may owe more taxes back if you took too much subsidy. So it's very important to get your income, your annual earnings right when you're determining that. And all of that can be done with an agent. I want to preface this so that you know that all of the health insurance items, you should always be looking for a health insurance agent. It at least in California, it doesn't cost anything additional to use an agent to help guide you through the process. And that way they can help you avoid the potential pitfalls of the tax credits and help you find the best solution that will fit your family in an affordable manner. And I'm curious who has, if you have employer paid insurance, there's something called the family glitch. So that's also important to know when it comes to the subsidies, that if you or your spouse have employer coverage that allows your dependents to be covered on your employer plan, you don't qualify for a subsidy, and you may not know that until it's too late. So be sure to talk with a professional who can advise you there. I also you are often probably hearing single payer, Medicare for all, public option. There are all these potential solutions that we're trying to come up with to have healthcare be what they call more affordable. And ultimately more affordable means that we need to be a healthier people, because health insurance is expensive because healthcare is expensive. Healthcare is expensive because we don't take good enough care of ourselves. So just be aware of what those terms mean. And a single payer system is more like a government run system that gives us less option. I just thought that's important for everybody to understand as they're hearing those terms. Be sure you understand what the definition is. And Medicare for all, they're thinking of decreasing the age of Medicare eligibility, which that might be a potential solution. The increased subsidies are definitely going to help a lot of people when it comes to health insurance. Other things to consider, I'm looking at my notes to make sure I cover everything. If you have chronic conditions, you should consider the lower deductible plans, because you may pay a little bit more in your premium up front monthly, but it'll cover more of your out-of-pocket costs when you receive treatments. So I'd say about 90%, if you know the levels of health insurance, they go from bronze, silver, gold, then platinum. And the higher the tier level that you go, the less out of pocket you pay. So a platinum plan has the least maximum out of pocket per year, and there's no deductible, and your co-pays for your doctors are a little bit lower. Where the bronze plan has it, you almost pay the maximum out of pocket before you have any services covered. Maximum out of pocket, I believe, is $8,200 right now. You get 3 doctor office visits per year. Most of my clients land in the silver range unless they do have a treatment or a surgery coming up. Silver is the basic silver plan is a $4,000 deductible, but your doctor office visits, the deductible doesn't apply. So you're just paying a copay. If you need lab work, you're just paying a copay and the deductible doesn't apply. So those are just some of the things that you consider with health insurance. And again, there's always a professional available. Across the country, there are agents who can help you understand and help you guide you through that process. I want to talk a little bit about Medicare today. You don't think that you need to know about it until the time comes. But when the time comes, you're going to be flooded with mail, constant marketing. So I wanted to warn you about that. I'd say about 6 months before your 65th birthday, you're going to start receiving a lot of marketing. And everything's going to sound confusing or lead you into a different direction. Again, find a professional who can guide you through that. It costs nothing extra to use a professional, and they're the ones that are going to know your market. I also often advise to find a professional that lives in your area, because a lot of times they know the doctor networks and can give you better guidance about what direction to go in your area. Looking at my notes here. It's also important when you're looking for an agent, some of the qualities that you want to look for, especially when it comes to Medicare products, find someone who works the entire market, meaning they don't just sell supplements. They also sell or are able to speak to Medicare Advantage plans and your prescription drug plans. All of those pieces are options, and you do need to piece together a package that fits your situation best. There are things to consider and timelines and deadlines that you need to consider when it comes to Medicare. You could potentially face penalties if you don't sign up for Part B in the right amount of time, or if Part D, which is the prescription drug plan, if you don't sign up for Part D when you're eligible in that 6 month, 7 month period, you could potentially face penalties that last your entire lifetime with Medicare. And again, all of those things, you don't have to remember this right now. Just remember when it comes time to reach out to a professional who can help you and who specializes in Medicare. The devil is in the details. Something important to know, many of us are still working long into Medicare time. So past age 65, when you turn age 65 and you're still employed, please do find out from your employer if it's necessary for you to enroll in Part B due to the medical plan, due to the health insurance that you have in place with your employer. The reason that's important is because in many cases, Medicare pays first before the employer's plan. And so you want to make sure that you're fully covered with that plan. And oftentimes the employer coverage will act as your supplement. Same thing with if you are on COBRA. We mentioned COBRA with the ARPA. COBRA has 100% subsidy. However, that subsidy is not available if you're eligible for Medicare. So be sure that you're looking at all of those details when you're enrolling in your health insurance. There's also something, so I mentioned many of us are still working when we're age 65 and over. There's something when you do apply for Medicare Part B, and this applies to Part D if you do need to pay what they call IRMA. And IRMA is it's an additional dollar amount based on how much when you file taxes, it's based on how much your household earns. So if you file, I'll give you an example. The standard amount of a Part B is $148.50. If you file an individual tax return and your income is $88,000 or less, you will pay the standard of $148.50 a month for your Part B. If you file a joint tax return, that dollar amount, the cap on is $176,000 or less, and you'll still be at the $148.50 mark. Now, if you're a higher income earner, let's say up to $165,000 a year, you're going to pay $386.10 for your Part B premium. There is a chart on Medicare.gov, and that can help explain. It's IRMAA is the search. So IRMA is IRMAA. It's income related monthly adjustment amount. And again, it's due to the Medicare system and making sure that people are paying into it. It's all based on the income, and they look 2 years back. So for people who are potentially looking at Medicare Part B today, they're going to look at your tax returns for 2019. And the same thing applies if you do have IRMA apply to your Part B. Should you choose a prescription drug plan, IRMA will apply to that as well. And that's why I say math problem. Because, for example, the high range on IRMA for Part D is in the it's $70 a month added to your monthly premium. And your penalty, should you not get Part D, is 1% per month that you didn't have Part D when you were eligible. And that's added on for as long as the time. So if you go 10 years without a Part D plan, you have to multiply. The penalty is 1% of the standard. This year, the standard's $34. I think it's $34. 1% of that is pretty little. And for 1 or 2 years, you can get by. And that way you may avoid your IRMA penalty, your additional IRMA add-on. However, if you add on a lot of years, those cents can add up. And once you're assessed the penalty lasts throughout your lifetime. So those are important considerations with Medicare. Do you have, Maggie or Barbara, do you see any questions coming through?
Yeah, we do have one question, and that was, what are the difference between Medicare A, B, and C?
The alphabet
How many letters are there? I mean,
there are a lot of letters. The main letters, that's a really good question. Thank you. The main letters are A, B, C, and D. So Part A is hospital. It pays for hospital, and typically that's what we get for free as long as we've worked for 10 years or 40 quarters.
Okay.
So that pays for that covers your hospital. Part B is your doctor office visits, your lab work, all of the incidentals that happen over time, as well as durable medical equipment. Sometimes injections. So if you get injections at the doctor's office. So Part B covers those kinds of services. Part A and B together cover 80% of your medical costs, which leaves you responsible for 20% of your medical costs, as well as your prescription drugs. Part D is your prescription drug option plan. And prescription drugs are actually one of the most important pieces of having someone help advise you through, and typically can be one of the most expensive parts of Medicare,
Definitely.
Especially for people who need to use more prescriptions in the process.
Right.
Now, I skipped Part C on purpose because, as I said, Part A and Part B are 80% of your medical costs, which leaves you responsible for 20%. Part C and a supplement plan. There's Medigap supplement. Sometimes it's referred to as Medigap. Sometimes it's referred to as supplement as a route you can take to cover that additional 20%. Or you have Medicare Advantage, which is Medicare Part C.
Okay.
The Medicare Advantage route is typically they're HMOs. There are some PPOs available, but even with the PPOs, you still need to stay in network, and there are network doctor issues, and you'll pay copays. Whereas the supplement Medigap route is kind of a free for all. You can go to any doctor that takes Medicare. You don't have to worry about networks anymore. It's a whole different mindset. Any doctor that takes Medicare, 90% of doctors across the country take Medicare.
Wow.
Yeah. So the caveat, though, for a supplement is that it is underwritten. It's one of the only things in health insurance that is still underwritten. Life insurance, obviously, is underwritten, but Medicare supplement.
Can you define what underwritten means?
Underwritten means that your pre-existing health conditions matter.
Got it. That makes sense.
You have a guarantee issue period with Medicare where you are able to not have underwriting on a supplement. And once you pass that guarantee issue period, then if you have a pre-existing, so let's say, for example, you don't feel like paying the premium for a supplement at the time that you first qualify for Medicare. So you decide to go to a Medicare Advantage plan. And you're rolling along for 3 or 4 years on that Medicare Advantage plan. It's working great because you're pretty healthy still, right? 65-year-olds, we're not dealing with all of that stuff that happens as we get older as much. So you're rolling along and you find out, let's say you get diagnosed with something that you want to go to a specialist, and you realize, well, I can't go to that specialist because I'm on this Medicare Advantage plan. I'm in a network. Let me look at this supplement option. Well, at that point, it's too late for you to get a supplement because you're diagnosed with a serious issue. That's a pre-existing issue. And they can actually decline you for the supplement, or they can even change the rate so that it's higher. So I always recommend that someone take a look at all of those options early so that you understand that even though it may look really enticing and they advertise on TV that it's free this and free that and free dental, really have an advisor talk about your personal situation with you so that you can make sure you're making good decisions.
Yeah, I've heard nothing in life is actually free. So
True story.
True story. All right, I'll let you get back at it.
I think that is unless there are other questions regarding Medicare and health insurance, that is all I have there. I thought for this group, I just wanted to bring up, I volunteer for the Alzheimer's Association as a community educator. And that it's important to me because my mother-in-law got dementia very early on. And I think there are a lot of things that we can do to help prevent that. So I wanted to just share some tips with you guys. Almost 2/3 of Americans with Alzheimer's are women. So it hits women harder than anybody else. The risk is 1 in 5. Couple of tips to help you prevent. Taking care of your heart helps take care of your brain. So all of the things they tell us to eat right and to exercise, all of the things that help our heart also help our brain. 25% of the blood flow from every heartbeat goes to the brain. So that's why it's so related to take care of your heart. And cognitive activity, things that you can do are read challenging books, stimulate the mind. Look at play games that have strategy, do puzzles that make your brain think of connecting things, and always be learning new things, which I think works really well for what we do here. You guys at Purse Strings help us all educate people to just make better decisions overall, to live a better, happier life. And I think that's all that I have for you today. Any other questions that possibly came through?
Oh, we definitely have questions. There are always questions. We always have questions. So what's a typical age women are diagnosed with Alzheimer's?
They say after 65, and believe it or so age is where Alzheimer's comes in. That is the major factor. It's as you get older, there's early onset too, but over 65 is when people are usually diagnosed.
Okay, and so it's really about keeping the brain active, keeping blood to the brain, all those good things they tell us, work out, just move.
Move.
And For different things like that, does it really matter if you're reading on a phone versus a book or doing like a Sudoku on a phone versus a book? Or is it just about getting the brain going?
So I'm not an expert in that. I couldn't tell you. And actually, I've not seen if they've even done a study yet. I'm thinking right now of the things that I've read as I've learned.
Yeah, I know it's a bit of a tough question, but I know some things are like, well, with the blue light and the, I don't know, different things, it's all.
I think for the purpose of Alzheimer's in particular, it doesn't matter. It's as long as you're engaging the brain in strategic thinking.
That sounds good. That sounds good. Let me see what other questions we have coming in here. And so does Medicare cover Alzheimer's?
Medicare cover the treatment of Alzheimer's. Now, here's something that's a really good question. In terms of long-term care, Medicare doesn't cover long-term care. And a lot of people think that when they hit Medicare age, all of that will be covered. They'll and Medicare does not cover long-term care. And it's also more difficult. And we're going to find that increase. The statistics for baby boomers, excuse me, the statistics for baby boomers are, I think it's a 20% increase in the next 5 years that we'll see of Alzheimer's because of how many baby boomers there are.
Wow.
And care is going to be really difficult to find. So that's definitely something we're going to have to deal with in the next few years.
We do talk with some of our professionals about long-term care and I was amazed by how much a live-in facility is. I mean, just amazed, blown away, and that's not covered. Is that something that you work with clients with, or do you send them somewhere else to try to work on long-term care?
Yeah, I usually use my own trusted resources to work with long-term care because it is specific. I feel like having experts in each of these little buckets of things that happen are really important.
Agreed. Yeah, purse strings we talk a lot about. It's not just one person, but your financial team.
Absolutely.
Your financial person, your attorney, your Medicare person, your long-term care, to make sure you're covered in all these areas, because you drill down and it can be kind of complex after a while.
Exactly.
And so if someone were to work with you, they reach out and email you, what's kind of the process that you take people through?
A really good question again, especially since I have been advising that you look for advisors. In Medicare, we are not allowed to be the first contact. So I can't call you. You have to call me first. If Maggie were to say, oh yeah, I'll give your name and number to Dawn and Dawn will call you. I can't do that because it's illegal for me to do that compliance wise. So it is important to be able to reach out directly. And you could, for me, so what you do is you either call me, I have a consent to contact form, or you can send me an email. You can also schedule using my calendar link. Those are all ways that you can reach out to me and I'd be happy to help.
Awesome. And is there any paperwork or anything people should have prepared before they meet with you?
Most time, your Medicare card is important. A lot of times what I find is in the initial conversation, I'm going to find out what you do have so I can tell you what we need for the next piece of the conversation. The Medicare, a lot of times people don't even have the process started for their A and B. So those are the things that we kind of decide on the first call. The first call is super easy. It's more of a fact finding. We're getting to know each other.
Awesome. Okay. And you were saying, and how much does this service cost typically?
I can talk in California. Actually, for Medicare in general, there's no additional. Agents are paid by the carriers that we write for.
So there's no reason not to talk to somebody.
There's no reason not to talk to somebody. Exactly. And what I do recommend when you're looking for an agent, make sure that someone who contracts with multiple carriers so that it's somebody who's going to be looking at all of the options, the big picture, rather than just one or two.
Definitely. And if anyone else logging on has any more questions, we'd love to take them. And we do have, I know you just serve California, correct?
Yes, I serve California.
Okay. And we have a couple other professionals if people are looking for different, if they're in a different state. We do have other professionals who serve other states. So if you can't reach out to Dawn, she probably has somebody else you can reach out to as well. Purse Strings also has some other people you can reach out to as well. Let me bring in Dr. Barb and see what questions she has today. Oh.
Okay, I'm unmuted. So, Dawn, that was great. I know Medicare, sometimes people just say the word and people glaze over because it sounds like it could be very confusing. But I'm glad you broke it down with the A, B, D, and C.
Good job.
Yeah. Well, I was taking copious notes as you were talking. So, and I've heard some of that before. Now, how much in advance should someone start considering learning more of the details around Medicare? Because they're not going to just learn it because it's good to know. They're going to want to know what's happening right when they're turning 65 or 6 months before. Because what I heard you say is if you're on COBRA, your situation's different. If you're currently working and still working, your situation's different. So there's all these different scenarios.
Exactly. Yep, that's exactly right. So 3 months before is the earliest that we can do anything regarding Medicare. Okay. So that's when we start need to be actively looking at what's going on.
Okay, great. And then I know you said that you can't reach out, and that's a compliance thing, right? So they're just not like trying to sell insurance policies to people.
Exactly.
But they do a lot of marketing through the mail. Like you said, there's a flood of different advertising and marketing, but they can't call you up, right?
Well, yeah, they're not supposed to. They do. I hear it all the time. I'm getting all of these calls that's not supposed to happen. And I won't do that because it's not the right way to do it. Yeah.
So are Medicare programs the same no matter, the cost the same? Isn't it set standard no matter where you live in the United States?
Part B, yes.
Okay.
The supplement and Medicare Advantage and prescription drug plans, that's where it gets variable.
Okay. Okay, got it. All right, well, that helps me understand it a little bit more. Yeah. And I think, people shouldn't get overwhelmed. Like you said, right. You should go to the expert in your area that you can ask all these questions of, and don't sign anything or purchase anything until you can reiterate it back chapter and verse and you understand everything that you're purchasing.
I think that's a really good advice.
Yeah, that's what we tell everyone. Don't make any financial purchases or decision unless you fully understand what it is you're purchasing and how it will help you and what it costs and all the details.
Yeah.
We love details. But thank you so much, Dawn, for coming on today. You can always reach Dawn at M&M Benefit Solutions Insurance Services. Her email is also at the bottom of the screen, and she's our wonderful Purse Strings approved provider. So you can check out her webpage on pursestrings.co. Yeah. And tomorrow we'll put out an overview of this whole presentation, so you can just download that, catch the whole video on YouTube, and reach out to Dawn. She'll be happy to answer any of your questions that you have. So thank you so much, Dawn. We really appreciate you coming on today.
Thank you, ladies. Thanks for the yeoman's work you do. This is really important to help women be able to feel comfortable asking questions and know that they have trusted advisors. I appreciate you.
Oh, thank you so much, Dawn. Yep, that's what we're here for. Thanks, everyone.
Talk to you later.
Have a great day.
Have a good day.
Bye.
Bye.